So hi, Dr. Nikita Vizniak with the amazing
Dr. Chung
and our supermodel.
Today
we're going to focus on an area that is very difficult to mobilize. Most patients find a lot of tightness here, especially as people get older. We see less and less flexibility in this region, and that area is the cervical thoracic junction. If we look at the region, it's the very bottom of your neck or top of your back for most people, and a lot of people wind up having this hunched over posture and then looking back up from this position right here, and it is incredibly difficult to mobilize. You have very small ribs up at the top, locking to vertebrae that are very tight, and a lot of muscle tightness that tends to occur at that apex. And if you're a good practitioner, this is an area you have to focus on for treatment for patients. So to start with, we'll go ahead and just demo a seated mobilization that you can do. We'll do two of them. I'll do one first, then we'll get Dr. Chung to do one. But the easiest one, or one of the easier ones to do, is something called the Cobra stance, where you have a Cobra with your hand here like this. It's hissing around, but you stabilize the patient's head, and your forearm actually stabilizes over the side of their head as well. You make a contact with your thumb and index here, and you wind up making a soft tissue pull where you drag your hand over to the back, sliding onto the spinous process. You can also use this for a rib mobilization if you want as well, but you're sliding over top, and then from here, you're generating just a little bit of force. And you can see how her head kind of drops to the side, and we generate just a little bit of force. And if you want, you can use it as a mobilization. And I can actually feel that your rib right there is quite prominent. Sorry, you can feel that. Yeah. Okay, big breath in. She breathes out, and you can just give nice relaxing and then quick movement in. Of course, if it's out of your scope to do a grade 5 mobilization, you can do it as a grade 4 as well. We have another fantastic variation that I love and Dr. Chung loves to do as well.
Because I don't have the height advantage, and unless I'm like getting up on the table to be able to do this type of motion, I like to use my leg power as much as possible and use my body as much as possible because I'm so small. I'm only 5 feet. So,
yep.
I need to use my body as much to my advantage as possible. So I'll just get Sahar to come back, shift back until you feel my leg on your back. And then what she's going to do is she's going to interlock her fingers and her hands behind her neck. Excellent, good. So then I get to do the double cobra.
Okay, there you go, nice.
So I get to slither through here, and then my chest is on Sahar's back. And then she's just going to relax, and she's going to drop her elbows, and she's going to drop her neck so that it falls down as well. So she'll be in this position, in a as relaxed position as possible.
Yep, excellent. Yeah, I was just going to add that if you look at this, number one, her stance is excellent. She's actually leaning through her leg. Her body position is here like this, so she's got a good, strong position to move from. The next thing is, as Sahar relaxes down, it gives a little bit of stretch over top of the tissue as well.
And then she can even drop her elbows more if she wants. There you go. And then, you know, if I get to lift her and I get to feel that drop, then I know that she's in quite a relaxed position. And then from there, you can do a little bit of a weave and a little bit of a weave just to get the more relaxed position. And then from here, I'm going to use my legs, and I'm going to essentially just stand up. And that's all you got to do. And then you're going to do a thrust through, and my chest goes forward to get that extension in as well.
Yeah, and that's an excellent point to make right there, is at the very end of it, when she's lifting up, she's pushing her chest up and flexing down at the same time, so it gives that good distraction for the upper thoracic and lower cervical spine. Not the most specific, but it does give a good relief for a lot of patients, and a lot of people do benefit from it, so it's an excellent starting point for your work from.
Yeah, if you want to be more specific with the seat, to have this seated mobilization be for the CT, you just have to make sure that the rest of the thoracics are cleared out first.
Yep, excellent. And what I like really well that she did is she let the patient relax into position before she did her weave and move back and forth. That little bit of relaxation makes a huge difference. Okay, let's go ahead and move on to two other variations for CT mobilizations that you can do, and we'll have our patient go ahead and lay prone if that's all right. And I'm going to clip this section out because I don't know how to fucking use my own table. Okay, so our first setup is going to be a standard CT junction maneuver. What I recommend for most people when they're starting is you start with this type of a setup. It's easier biomechanically for you to move like this, and it gives good biomechanical advantage as far as weight pushing down as well. So first thing for us to get, number one, foot position. My heel of my front foot is basically level with the mid-cervical spine. I'm going to take my thenar eminence and use it as a contact over top of the lateral side of her transverse process or spinous process right here onto the transverse process. So the tissue pull starts more proximal, and you bring yourself up and away like that, up and lateral. Key thing to get is different people have different flexibility of their fascia and tissue, and for some people you're going to need to start a little bit lower, some a little bit higher, but you want to make sure that you end with a good lock-in position. The next thing is the opposite hand is going to take the patient's head and just turn them to the side just a little bit. You're doing a counter rotation force to allow this movement to happen. And then from here, you're going to have your patient take a big breath in. And as they breathe out, you want to follow them out to mobilize, 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 and just give a little bit of pressure over top. Now, a key thing to get here is my whole body spun in and generated force right there. Spinning in and generating force. This is going to be a high velocity technique. You go ahead and take a big breath in, and then all the way out, and it's load, 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 and little drop at the end of it. Either way, a great way for you to mobilize the upper thoracic and lower cervical spine. But there are other options. Dr. Chung.
I like to do more, or I like to mobilize more from a caudal position and set up in this position. And the reason why is just I find it pretty awkward to be able to get over that body and be able to generate enough force in that pinpoint CT junction location. So I like to use my small hands to my advantage and be able to get into the crevices and get into that junction, and then just be able to do a high velocity thrust through there.
Yep.
It's going to be the same. It's very similar to what Dr. Nick had showed on the seated position. And I'm just going to find where the CT junction is. I'm going to use an index contact and push against the SP instead of having to pull and then push onto the TP essentially when you're doing the setup that Dr. Nick had done. So I just simply, well, not simply, I do a tissue pull lateral to medial towards that SP, and then I'm still doing that counter rotation force, hooking underneath the occiput with my thumb and my thenar eminence, and then be able to do that counter rotation. So it's exactly the same movement, it's just in a different position.
And that's a big thing to get. People look at these and they think, oh, it's such a different maneuver. It is a different, the way that she's set up, but biomechanically on the patient's body, it should be the same action that's taking place.
And it's exactly, so if your fingers are pointing in the opposite direction, you know that you're going in the right direction.
Okay.
And then it's going to be exactly the same, right? So then I like to be able to lean my body into it and be able to do this adjustment. So she's just going to breathe in, and then she's going to breathe out, and then you're just going to lean your body into it, doing that counter rotation and doing about, say, 80% here and then 20% on the head.
And so we're clear, yeah, it's 80% into the thoracic and about 20% on the head. And that was something I should have said for the previous mobilization we demoed as well. You want to put most of your force into the thoracic spine.
Yeah, exactly. If you end up rotating the neck too much, then you're going to get a lot of accidental cavitations in the cervical spine.
Yeah.
And then if you're going to do a high velocity, low amplitude, then it's going to be a breath in and then out, and then you're going to follow that breath through, follow it through, and it's going to be a thrust through there like that.
Excellent. All right, anything else you want to add for CTs?
No.
No? Okay, there are a couple of other variations that you can do that involve like thumb spinous pushes as well. I'll show those just really quick. They are in the book that we can look at here in just a second, but the bottom line is for these setups, the goals are effectively the same. I'll go ahead and start off. Usually it can be your call. You can be standing, seated, depending on the height of your table and size of the patient and your size as the practitioner, but you'll still hook into the bottom. And the key thing to get for this is you make a nice L shape with your hand that hooks into the bottom of the occipital bone. Now, if I just went on her hair here like this, I'd actually slide off. And you want to make sure to get the hair out of the way so you can hook into that nice sweet spot below the occipital bone there. The next thing is you have a couple of options. Your contact hand on the thoracic vertebrae, you can put those over top of spinous processes and do that counter rotation force. And you can just use this as a nice gentle mobilization if you want to start. Just nice and simple, moving the person through. If you want to change it, you can actually go the opposite way, where I'm going to mobilize with this hand and I'm going to counter rotate her the opposite direction. So this time I'll roll your head this way, sorry, yep. Make that nice L shape with your hands right there, hooking into the back of the occipital bone and then coming from the opposite side. And what I like to do, especially if I have bigger patients, I'll even take and put my elbow inside of my own thigh and generate a little bit of force there where we can mobilize and move them around from that position. The other option that you do have is you can set this up where I can rotate her head towards, or she's looking away from me, but pushing her towards me, and I can take my opposite hand and put it over top of the spinous process and to the transverse process as well. And the same thing here. Big breath in, and then all the way out. You can just go ahead and follow the breath and mobilize, or you can give a high velocity thrust and mobilize as well, depending on what your scope of practice is. But again, these are covered better in the text. You can see a lot of variations right there. Ultimately, it's to your best interest to try lots of different techniques and pick one that works for you.
Exactly. And even with these, a lot of these techniques, they're therapeutic in themselves as well, right? So you don't necessarily have to do a mobilization or think of it as a mobilization. Like if we go back to the example that Dr. Nick was doing, using the thumbs on the spinous processes and counter-rotating that head, it looks like you're moving a lot of fascia. It looks like you're really getting into that muscle bellies and being able to introduce that touch to be able to relax out those muscles, so then by the time you do that adjustment or that mobilization, then it'll go easier.
Yeah, excellent point, excellent point.
But I did feel relaxed at every point of contact.
Cool. Yeah. All right, that's why we're doing this. Hopefully you found this useful, and thank you very much for your time.